guys, welcome back to Meds Made Easy. My name is Tarun Verma with Telfair Specialty Pharmacy. Today we're going to talk about Sitagliptin, also known as Januvia. Really great medication. Let's see here. It is for type 2 diabetes. It's a DPP4 inhibitor. That means nothing to you. What it really means is it decreases your hepatic glucose production. Essentially what happens is whenever you eat, your intestines, they release incretin hormones, and they regulate after every meal. So what it does is it prevents it from stopping that. So it keeps it going. So it decreases glucose production, increases how your body responds to a meal, and helps maximize it. Because whenever you eat, insulin is released that kind of controls the sugar, brings it down, and puts it in, and essentially it stores it in as fat. And so glucagon breaks that stuff down into sugar when your body needs it. Again, I'm not doing a good job at this. Just let me explain it by just saying it decreases your glucose production. Okay, that's the easiest way to do it. There are two methods in which we treat diabetes. We treat the number and then we treat the disease state. This really helps us treat the disease state really well because it controls the intestinal part of how we regulate blood sugar. And the other medications will hit other parts of our body, but this one hits our intestines, and it does a pretty good job there. Let's see, here's a list of these side effects. It's dosed generally once a day, easy. That's always how we've seen it. If it's something new, then it's because your doctor's trying something interesting with you. But really, in like majority of the population, we see it at once a day. Take it in the morning. That's the best time to take it, unless there's a reason why a doctor wants you to take it in the evening. For people who have renal issues, you do need to have things kind of tweaked for you. So make sure your doctor knows. For those that are going to be pregnant or are pregnant, this is a conversation you need to have with your doctor about taking this medication because it can cause issues. For lactation, I don't think they had any evidence or anything that shows that it comes out in your breast milk, but it is also a newer drug. So right now the evidence is inconclusive. When a medication first comes out, everything looks honky-dory, but then you give it a couple of years and you let the scientists study it, then you start to realize there are issues with the medication. So right now, as of now, there aren't too many issues with the medication. It's really well tolerated in the population, and it's an adjunctive, meaning you add it on to other diabetic therapies that you're using, and that's how you're able to maximize how we treat diabetes or how we're treating your diabetes by adding in, medications A, B, C, and D, putting them together and hoping that they have a synergistic or a better effect together than they would have by themselves. So I think that's it, guys. As always, if you have any more in-depth questions, please let your doctor know. Call your local pharmacist or call us here at Telfair Specialty Pharmacy. We'll break down the whole diabetic disease state. It's a topic that's very close to me. I have a family history of it, so I am completely on top of diabetes. I am on top of the latest stuff coming out and how they're doing things, so we can have a great conversation about it. And as always, please leave comments below. Let us know how we're doing. If there's something we're leaving out in these videos, let us know, because these videos are for you guys. They're supposed to help you, and if they're not helping you, then we're not doing our job. So just let us know how we can make the videos better, and we'll do that. We'll add them in there. All right, guys, that's it, and we'll see you next time on Meds Made Easy.